So now we'll do some exercises, okay? We will do it, okay?
First exercise, sitting. Hold wrist with other hand.
Okay, hold your wrist with any one hand, okay?
Take your arm back.
Yeah, okay, so 1, 2, 3, don't move your head, 4, 5 at the back, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5. Okay, relax. So did you all feel your upper back muscles moving? You remember the posture? This is good for that, okay? Now we change our hand to another 15.
Palms
No, darling, same exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5. Great. Let's. Okay, now. Yeah.
Palms facing up and arms on side and take it down.
Yeah, space yourself before we begin. Okay?
Palms facing up, arms on side and take it down.
Okay. 1, 2, upper back, 3, 4, 5, आगे नहीं लाना, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, आगे नहीं लाना, 7, 8, 9, 10. When I was saying आगे नहीं लाना, some of you were doing like this. इधर नहीं, इधर से शुरू करके पीछे लेने का. Okay, the next.
Third one is hands on waist.
Yeah, hands on waist. Okay, so we take our elbows back. Okay, I'm showing very simple exercises. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take your elbows a little more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The smaller the movement, the better. If we are doing like this, usse this is better. Small movements. Okay? And when you do that, your chest should get lifted up. So I'm doing a wrong one and then I'm showing you the right way. So when we do, look, see, I'm doing the same thing. Isme, my chest is not getting lifted. But if I do like this, I'm not lifting my shoulders. I'm lifting, my shoulders are going away in fact from the ears. I'm not doing this and nor am I doing this. I'm doing this. You see that? Little arch in the upper back. And that will make you feel much better. Okay, next.
Okay, the next one is hands behind your head and elbows back.
Okay, so now we take our elbows behind. 1, 2, 3, 4, 5, 6, 7, 8, small movements, 9, 10, small movements. Small is big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The last movement, okay, 1 minute. One more exercise we'll do. Everybody okay? Yeah. No problem? Okay. So now I'm going to lift my arms up and take it down. Okay? But what I'm going to do again, my abdomen should become longer, my chest should get lifted, and my shoulders should not go up at all. Okay, if I do this, it's wrong. So the distance between my earlobe and shoulder should actually increase. I'll just do it once. So when you take your arm up and you do this, you see this? Yeah? And take it down. And the arching should be more from the upper back rather than the lower back. Okay, so start. You breathe in, your hands go up. And when you breathe out, your hands go down. If you have a problem with the shoulder, you can keep your elbows a little bent and then take them back, okay? So it's not necessary that you keep your hands completely straight. So let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we'll do a little challenging. We keep our arms here and take them back. Small movements. Less is more, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. How does your upper back feel? Good. One more exercise for the upper back. Ready for it? Okay. So palms facing the floor, but now your hands are much lower. Everybody's feet are on the floor. Feet on the floor. Feet आगे आइए, आगे आइए. Okay. So we take our hands back as much as we can and relax. So 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Wow, clap. Great work. Okay, we'll do something in standing. So Alpana will tell me the next exercise.
First exercise standing is hands on waist. Partner hands should.
Yeah. So now we do it with a partner. So two of you can be partners, two of you, and I'll get one girl come to me, come Preeti. So I'll show you what is to be done. Okay. So put your hands on your waist. Okay. You have to be gentle but yet firm. So I'm going to hold her near the shoulder. Okay. And what I'm going to watch me what I'm doing. And I'm going to take her shoulders behind like this. She should not get pain. She should feel meetha dard. You can call it meetha dard. Okay. So my hands are here. My elbows are on her elbows. And I'm taking her. How does it feel, Preeti? Very nice. Yeah? Elbows on the elbows. Most of you are not doing it correctly. Elbows on the elbows. Okay. Yeah, okay. Yeah, okay. Elbows on the elbows. Okay? And now I take it back and I hold it. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Now, change your partner. I'll do for you. Come. You do for each other. Elbows up. Okay. So now, elbows on the elbows. And this is light. I'm not doing any pressure here. I'm doing it with my elbows. Okay? You don't do anything. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If anybody is not understood, they want to come to me, I'll do it. Come. See, what you have to do is here. And now 1, 2, you don't do. 3, 4, 5. Your hands are not on the waist. Hands on the waist. 1, 2, 3, 4, 5. Yeah? For me? अब जोर लगा रहे हैं. नहीं. दर्द नहीं होना चाहिए. बिल्कुल दर्द नहीं होना चाहिए. I'll do it for you. I'll tell you how to. 1, 2, 3, 4, 5. समझी? Yeah. 1, 2, 3, 4, can't be done by everybody. So I'm just demonstrating it. Okay, so this is, remember we did push-ups on the floor. That's difficult for many of us. You can do bench push-ups. Okay, so what you do is keep your body completely straight, keep your butt tight, and you do 1, 2, keep your elbows close to the body, 3, 4, 5. It's an excellent movement for the arms. So we are focusing on the arms now, and arms get a lot of good amount of workout when you do this. Body completely straight. Body goes forward together, back together. Forward together, back together. Okay? This can be done by most of us. Okay, next. Okay, okay. This also. This is also very good for the arms. I remember I said bone density improvement is site specific. So if you work on your arms will get stronger. Otherwise, okay. So I hope this table is strong. So 1, and when you are going up, 2, 3, 4, 5. No, you don't go very much down. So this right angle hona chahiye. The elbow should be only right angle. It shouldn't be an acute angle. You know what I'm talking about, acute angle. So it's not a heroic thing. This much is okay. This is fine. Elbow angle should be not more than this. It should not be an acute angle. Yeah. Okay? So I was telling you how to climb up steps, right? So that your muscles get stronger. So there are 2 things that can do as an exercise for step climbing. One is the aerobic workout. So you go tuck, 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 tuck on the steps, and that is like an aerobic workout. But if you want to make your muscles stronger and therefore the bones, how do you go up the step? So what you do is when you put your leg up, you press with your heel and go up. Okay? So again, you press the heel, and pressing the heel and going up. So it's a slow going up the steps. 80. So you do cardio at another time, this is another time. This is for bones and muscles. So you're pressing the heel and going up. Okay? So what happens is when you press the heel, you get the strength. So if anybody wants to try up the whole leg, you will feel the muscle tightening and enabling you to go up. Okay? So that's what you do. That's how you do strength training for the bones. Push and go up. And pushing. Remember we have that stepper in the gym. Something like that effect is created. Okay? So that's another one.
Next one is speed walk.
Okay. So yeah? No, the steps only. I'm just got one step. Stairs pe. No, and you can do many more, of course, on the stepper. If you have a stepper, you can, like, suppose this is a stepper, and steppers can be of different levels. So for my some of my patients, I just give them a patla, apna juna patla, this much only high. So I give them that. Then a little more, then a little more. All levels you can do to challenge, and much higher than this also you can do. But the same exercise. And you can do the same thing sideways. So step up and go down. Okay? So you can do that. You can do many formations, then you can do.
The story is not to use the lift.
Yes, not to use the lift, absolutely. Climbing down, same way, no? So, well, ideally we shouldn't be using the lift as much as we're using nowadays. So climbing down slowly gives you better muscle work. If you go down fast, it's very easy. Okay? So slow down your going down the stairs. Okay, next one was? Speed walk. So many of us go for a walk, right? And when many of us go for a walk, yeah, sorry? Good question. So now we are not talking of bones, we are talking of the knee joint. So if you have what we call a patellofemoral problem, that means the kneecap is not gliding on the bones correctly, then we have to first get it corrected. There are beautiful methods. We do taping, we realign the bone, we get special x-rays taken to see the status of the bone. Most of the time when you're climbing down and it's painful versus not climbing. So when you are climbing up, it's your main joint that is under stress. Your main, this and this bone. But when you are climbing down and you have pain, it's your kneecap that's not tracking properly. So there are special exercises for that and special taping techniques that can be done, and it can be made all right. Yeah. So then you make it all right and then do it. Yeah. Okay, speed walking. So most of us go for a walk, but what I suggest is that, this is what has been suggested, that when we do not increase the stride length. That's not recommended. What we need to increase is the way our arms are moving. So, like this. Move your arms. This is a good speed walking style. Okay? તારે પાછે કોમ્પ્લિમેન્ટ્સ જોઈએ છે?
They have that walking competition, and when you watch them, they're always
exactly.
So I always ask you that in speed walking, should you sway the hips or not?
Sway the hips not excessively, but when you move your arms like this, you automatically sway your hips.
No, but they walk
No, you don't have to do like this.
not like that. What they do?
No, I don't think so. I don't think so. I don't think so. Yeah. Okay, good question. Can we take the questions afterwards? Yeah. Okay, she has a question which we'll take later. So I told you balance is very important. Now this I want all of you to do. So walk like this. Okay, heel to toe, heel to toe. Chalo bada, chalo. देखा? Come. See, heel to toe. Yeah. Touch करेंगे. Balance. Touch नहीं हो रहा है. Touch करिए ठीक से. पर अच्छा हो रहा है.
Okay, now we have last one. Circle with leg complete.
Okay, those who couldn't see, come in the front. So you take a circle. Remember the hip joint is very important. And balance, so you take your leg out. And so you take a so big circle but slow circle. Okay? So small. And you should keep your body straight as possible. If some of you are not able to do this and you're falling like this, the balance is an issue and we have to focus. Slow. Viva, slow. It has to be slow. Slow. Slow is important. Remember cycling, when we do it fast, it's easy, right, to keep the balance. When we do it slowly. Okay? I think that's the last exercise of the day. And thank you so much, girls. Thank you. Okay, sorry, I forgot. We want to take a few questions, 1 or 2 questions. Yeah, okay. One second, everybody can sit for 2 minutes. 2 minutes, we'll just take 1 or 2 questions. Yeah?
Many questions.
Everybody please sit down. Once you sit down, I'll start. I know we are hungry, all of us. Just 2 minutes. Yeah. So, hello. Can we have? I can't talk very loudly. So, the question was, what about walking on the beach? Okay, I'm not for walking on the beach. Number one, because the beach surface is always a slope. Towards the sea, it's lower and here. Okay, number one. Number two, if the sand is very dry, your leg goes in more. So if you're fit and you're 20 plus, no problem. If you're very fit at 50 plus, no problem. But if you have even a little bit of a leg problem, and now I'm not talking of osteoporosis so much as osteoarthritis, then I don't recommend. If you are on wet sand and somebody has walked earlier on it, then again you are having this imbalance. So that imbalance that occurs can get your knees worse, especially if you're doing it every day. So I'm not very much. I think you had a question, no? Backward walking, very good. Very good for you. Very good. Anybody else? Last question.
I have a question.
Yeah.
Does drinking tea or coffee cause?
Yeah, if you drink more than 3 cups of tea or coffee or any caffeinated drink, yes, it does affect your bones and you may get bone loss.
And what about when should one start taking supplements? From what age?
So I told you that by the time you are 40, it's a plateauing. That means it's the end of the plateauing season, right? The new bone formation and old bone formation is no longer equal. Then after that, the fall begins. So at around that age, at least, you should start taking. And if you're poor in your diet, in your childhood, in your teenage years also, then also maybe you need supplements. But usually good food takes care till the age of 40. After that, supplements thoda lena padta hai.
No, but our age, what you recommend? 60? We are all around 60.
Yeah, so supplements lene ka. मैंने दिया ना supplements. Calcium, magnesium, vitamin D, some boron, silicon. But it's best to 1 minute. When I talk, if other people talk, I can't handle it. Because I have to speak louder then. So supplements, best ask your doctor what to take because it's individual, how much you need, and you should always get your tests done. If you never get your blood, vitamin D, we get patients with high levels of vitamin D. And by the way, serum calcium is no indication of the amount of calcium in your bones. So when we get our blood report and we get calcium, oh very good, that's not your bone calcium, that's your serum calcium, your blood calcium. So vitamin D we can check. So vitamin D, if we never get it checked and we keep taking, or we take too much of calcium can cause problems in the arteries. So everything is a balance.
And we have the last question of the day.
Do we how much we should walk? Like 1 kilometer, 2 kilometer, or 45 minutes, or because people like 8 kilometers you have to walk, 2 kilometers you have to walk.
So there is, okay, there is no max in this. Okay, you do it according to your capacity. If you've not been walking every day, start with 20 minutes. If you've not been walking, fast walking, pick up your speed a little more. So it's like, also you should not be walking so much and then your joints start wearing out. And ideally, we have something called preventive physiotherapy, which is very important and not very well known. So what I tell these people who come to me, they may start a game of squash or tennis or walking or any other thing they want to start now. What I've been trained for is preventive physiotherapy. What it means is that I tell them that first you get your musculoskeletal evaluation done, which is not known. We get a blood test done, we get all these things, but musculoskeletal evaluation done, on the basis of which I will prescribe you exercises. So when I was at the University of Southern California, because you asked, what we did was, we did for all the children from 5 to 18 years, we did a musculoskeletal evaluation, and all of them were in a particular sport. So as a result of it, when we started prescribing specific exercises for Harsha, for Hema, for you, all different people take all different exercises. Then what happened, the chance of injuries in those athletes or those youngsters decreased dramatically. They did not get the injuries they were getting earlier. Number one. Number two, they became better in the sport they were already playing. So if they were playing football, they became better because now their musculoskeletal system is more in balance. Otherwise what happened, वो coaches सिखाते हैं, सबको एक ही exercise सिखाते हैं. It's not like that. It has to be specific to the person. And the best thing that came out of that study was we could prescribe what particular sport a child will be good at. Because a discus thrower cannot be good at running, a sprint runner cannot be good at marathon runner, but we don't know. Whatever we are able to do, why do we produce only one Neeraj Chopra? Because we don't know which sport we'll be good in, we don't know our children will be good in which sport. So we have a body type, we have a musculoskeletal type. So that was because you asked that question, it was a very interesting study that we
Will
did.
you write which test we have to do on the check?
What? For what?
Whatever you say.
Musculoskeletal evaluation, that's not a test. You have to go to a physiotherapist, she or he will do a full body musculoskeletal evaluation. Yeah, of course, yeah.
Okay.
You have to be trained for that.
Are we have to give break to supplements?
Sorry?
Do we have to give break to the supplements?
You should ideally get your, for example, vitamin D level done. Calcium we don't come to know. So I normally say take 500 milligrams of calcium. Do not take too much because food also is there, na? So 500 milligram, not 1000 and 1200. Then you can get in your arteries deposition. Children, see, we did it from 5 years, but usually I would say 10 or 12 years for our children. Yeah, because they're still growing up, some amount of growth. But even at that young age, 5 years old, some of them had very tight calf, for example. And when they ran, their knees was getting affected because the calf was so tight. So when we started showing them calf stretching exercises, the knee became more free and was not loaded excessively.
Thank you so much, Dr.